Probably a good third of the cases that I do, and I do Asian eyelid surgery every day, is for asymmetry. Patients come in and they have either two creases that are somewhat different or a lot different. Maybe they have a little bit of ptosis on one side, or maybe they have a complete monolid on one side and a pretty good crease that they like on the other side. No matter what the situation is, when it comes to asymmetry cases, you definitely want to go to an expert who not only does Asian eyelid surgery regularly, but who can actually show you evidence. And they shouldn't even have to show you the evidence of their work in the office. If they do this very often, the evidence should just be out there, plastered in public. The education, the information about asymmetric cases of Asian eyelid surgery, if that surgeon says that they do those surgeries all the time, you should have been able to see the evidence of that before you ever arrived at that person's office. Now, when you're going into an office and you're getting your consultation for the asymmetry issues that you're having with your eyelids, the considerations can be very similar to what I said for the double eyelid surgery, that basic younger patient category. Again, you need to be clear about what your goals are, talk to your surgeon, make sure that they're listening to you, they're repeating back to you, or they can clearly understand what it is that you're asking them for. But not just repeating back to you, okay, you want your eyelids to be symmetric. They need to repeat back to you the details of what you said and what you discussed. And you need to remember the details of what you said, what the surgeon said, and what you discussed. When you're undergoing an Asian eyelid surgery case to correct some asymmetry, one of the general things to remember is that your healing time may be different from other people, in the sense that if the surgery on one side, especially if it's a ptosis case on one side, is different from the left, say the right, for sure the healing process is going to be different on the two sides. If you find yourself in a situation after surgery, either a few weeks or even a few months or several months after surgery, where things aren't really settling into place just yet, even though your surgeon is guiding you through the process, reassuring you, telling you to wait, if you want to get other opinions, that's fine. Don't get 5 or 6. Get opinions from maybe 2 or 3 other people who also have experience in doing asymmetric Asian eyelid surgery cases, and just take it from there. So it can be a little challenging as a patient to go through that process, because it can be unnerving to look at yourself in the mirror and notice that the two eyes are actually a bit different, or even a lot different, in the early phases after your surgery. Now, the complexity of performing Asian eyelid surgery on a person with asymmetry or asymmetric anatomy on the two sides, it's there. It's not always more difficult than just a basic double eyelid surgery, but it can create some challenges. So again, you want to go to somebody who's got a lot of evidence of the good work that they've done in the past.